This is The Beat with Radia B, a conversation about the Charleston County Sheriff's Office in our community. Welcome to The Beat, hosted by Radia B. Today's episode, we have Dr. Thaddeus John Bell here to talk with us about the COVID vaccination. Hi, Dr. Bell. How are you doing today?
Well, first of all, I'm doing well, and I'm very happy to be here with you today.
Thank you. So tell us a little bit about yourself. Tell our community and our population a little bit about yourself.
I have been in private practice in the Charleston area for about 45 years. As I'm sitting here in this venue, it reminds me that I was the doctor for the Berkeley County Jail and Charleston County Jail for about 10 years. So I'm very familiar with the setting that we're in. But I'm currently in private practice in North Charleston. I'm retired. I'm a retired professor from the Medical University and retired military as well.
You can probably tell us what has been the biggest challenge in regarding the COVID pandemic.
Well, over the past almost 2 years, the issue that I've been dealing with through my nonprofit, which is called Closing the Gap in Healthcare, has been dealing with the pandemic. We've been trying to educate the African American community particularly, and the community at large, about the facts, and we've spent a tremendous amount of money trying to encourage people to take the vaccine.
So, in saying that, why are people so hesitant about taking the vaccine?
Well, that's an interesting question, and one that I think about daily. African Americans and the underserved have a lot of mistrust and distrust with the healthcare profession. Particularly people in my age group. People in your age group are not taking the vaccine for a plethora of reasons. Mistrust, all of the fake information, the confusion that has been around the vaccine and how safe it is. You know, we keep telling people, to get information from your trusted healthcare provider. Well, what we are finding out is a lot of young people don't have a trusted healthcare provider.
Right.
Okay? They don't watch the news, they don't read the paper, and they get their news from social media. Social media is plagued with a lot of misinformation.
Right.
And so as a result, it has created a major gap with reference to the health information. In fact, so much so, and you're going to laugh at this, I recently started putting a lot of health tips on TikTok.
Right. Yeah, I saw.
Oh, you did?
Yes,
see? So
yes.
One or two of them have gone viral.
Yes.
I've been really happy about that.
Yeah. So I think that's an awesome way of closing the gap. Or bridging the gap. We were trying to get our juvenile population to do the COVID vaccination, and then we had some issues with their parents just approving that they can get the vaccination, and they say that they feel that it's not safe. So how can we change that narrative?
I would try to find out who they trust. Once you find out who they trust, a lot of the young people trust a lot of hip hop artists. A lot of them trust a lot of athletes. Just make them aware that a lot of the athletes have taken the vaccine. A lot of the hip hop artists have taken the vaccine. I tell them stories about young people who have not taken the vaccine and how not taking the vaccine has destroyed their life. Most of the people who are in the hospital now who have gotten COVID end up dying because they did not get the vaccine. Wow. If they had gotten the vaccine, then they would not have gotten sick, ended up on a ventilator, and end up dying. I have seen a lot of death that came as a result of a young person infecting their grandparents or their parents. And when you tell those kinds of stories, hopefully you will be able to get to them. Now, what's going to happen as a result of the president's mandate, and I can tell you that insurance companies are looking at this as well. If people don't get the vaccine, their insurance premium is going to go up. Just like your insurance premium will go down if you can prove that you lead a healthy lifestyle.
Right.
It will go up if you tell the insurance company, yeah, I smoke, and yeah, I use drugs, and yeah, I do all these other things. Your premium is going to go up. You have to kind of meet them where they are. What I've been doing, I've been going to the barbershops and sitting in the barbershops talking to young men
Good.
and finding out what kind of issues they have. I've been addressing those issues. And interestingly enough, we've been able to change some minds. I was real happy the other day. I got invited to come to Charleston Southern and talk to the football team.
Oh, okay.
At that time, about 85% of the team had decided not to take the vaccine. But after talking to them, the next day the coach told me that about half of them had decided that they were going to take the vaccine based on some information that I gave them.
Wow. What are some COVID symptoms?
Well, the COVID symptoms have changed, and I can tell you that they are just kind of related to the flu. Fever, the sniffles, headaches, coughing, diarrhea, muscle pain. When people present to me with those kind of issues, the first thing that I do is recommend that they get a COVID test. And 90% of the time, I have been correct. We have to remind people that some people don't get any symptoms.
Right.
You know, and so that's the thing that makes the disease so horrifying. And then, of course, your symptoms can be worse if you have some pre-existing conditions,
I was just about to
which
ask you
is
that.
which is the thing that we have to be very, very much concerned about. But the thing that gets a lot of people are walking around with medical issues and they don't know they have medical issues until they get COVID. And then when they get COVID, the medical condition exacerbates, which causes them to end up in ICU and on the ventilator.
Right. So what would you say to folks who are saying, well, you know, I have diabetes or I have other health conditions, I can't get the vaccination?
And see, that's where the information gap, because that's the reason that you should get the vaccine, because you have these pre-existing conditions. The other day I saw a lady who had, I just made the assumption that this patient of mine had already had the vaccine because she had diabetes with 3 complications of diabetes.
Oh, wow.
She had an amputation, had already had a major heart attack, and already had a light stroke. So I just made the assumption that she had gotten the vaccine. So on my way walking out the door, I said, well, which vaccine have you gotten so I can put it in my chart? She said, oh, I haven't gotten any vaccine. I was furious. I said, well, why haven't you gotten the vaccine? And her comment to me, because I want to wait and see whether I got the virus.
Oh, wow. And that would have been too late.
Not only would that have been too late, that's crazy.
Yes,
That comment is just crazy.
So what can we do as law enforcement agencies to help with getting the word out, or, you know, getting people to go ahead and go get their vaccination?
Well, I think it would be very important for law enforcement officers to have the basic knowledge about the vaccine, so that when they do talk to people, particularly from the African American community are from a young population, that they'll be able to knock down any of these myths and untruths that they will hear. The people who are dying have not been vaccinated. The people who are living have been vaccinated, and that's well documented.
Right.
You don't have to get into a whole scientific discussion. These young people just don't have basic knowledge about the vaccine, and so that's the reason why they're not going to take it.
Right. So, Dr. Bell, you know, our community trusts you. We believe in everything that you give us as a healthcare professional, as a medical doctor. Tell us why you trust the vaccination.
Well, thank you very much for that acknowledgement. In my experience, in my medical experience, I have always taught African Americans and the underserved to take vaccines, because I know historically vaccines have saved more lives than any medications, all of the medications put together. I mean, if you just look at the history of smallpox almost wiped out the army that George Washington had. And if you go back and read that history, that's well documented. I remember the polio vaccine and how many lives the polio vaccine saved. And then even before this pandemic, I was always encouraging the African American community, particularly, to take the vaccines, particularly the flu vaccine, because I recognize the pre-existing conditions that we talked about are higher in people of color than they are in any other group of people. And so when this pandemic started, I said to myself, wow, it's gonna take out a significant portion of the African American community and poor people and people who did not believe in vaccines. And of course, that's the way that it is. Now, on a personal level, I was diagnosed with prostate cancer, and so I have all the reasons to take this vaccine, okay? The cancer is under control, and I've had radiation and hormone treatment, but in order for me to continue doing what I like to do, I kind of have to practice what I preach.
Right.
Okay? And the other thing is I'm a medical scientist, and so I know the science. It would be very hypocritical for me to be promoting something and not being willing to do it myself. Wow. And so that's why I have taken the vaccine.
My daughter comes home from school and she's fit to be tired because a lot of her colleagues refuse to wear their mask. What can you convey to our community at large, how we can make sure that we are providing safety to our young ones?
Well, the first thing I would recommend that they do is do not listen to politicians. This is not a political issue. The virus will kill Democrats, Republicans, or if you don't have a political affiliation. I would tell your daughter to continue wearing her mask, particularly when she is out and about with other people because of the Delta variant. I have two grandchildren who, one just turned 12 about 3 weeks ago, and we couldn't wait, and he couldn't wait to get the vaccine. And then my granddaughter, who's 13, had already gotten hers. They were with me the other day, and we were out and about, and I really didn't have to encourage them to take, to wear their mask. So the bottom line is that it is important to wear your mask, even if you've been vaccinated, because we do know that there is a small percentage of people who will have breakthrough infections. If they have a breakthrough infection, they will get sick, but they're not going to end up in the hospital, and they're not going to end up on the ventilator because they have had the vaccine. Yes.
How can we support our healthcare workers?
Well, I think that we can support our healthcare workers again by making sure that as law enforcement people that we have the facts and that you in fact have already taken the vaccine.
So now we know our healthcare workers are overworked, stressed out, and how do we help them?
They are accustomed to seeing people die, but they're not accustomed to seeing people die who are the same age they are.
Wow,
it's kind of like the natural order of things to see older people die. You kind of expect that. But when you see someone come in the hospital and they have to get put on a ventilator, and they 25 years old, they're 30 years old, the same age as the people who are taking care of them. And then the people who are taking care of them recognize when they do a history that 99.7% of these people are in the situation because they did not take the vaccine. And so they see that over and over and over again. And so, as much as we can prepare young people, but we can't prepare them for that kind of trauma.
Right.
Okay? And so they suffer from significant PTSD in their early career. Some of them already burned out before they get 35 or 40 years of age. And then they've had a lot of doctors and nurses who have gotten so psychologically overwhelmed that they have committed suicide. You don't hear about it a lot, but that has happened. So I think that when this pandemic is over, it will have taken its toll because a lot of doctors and nurses will already have lived a life journey in medicine that would have taken 30 years. They've already done it all in 10 years or 5 years.
Wow.
Yeah. So it's going to be pretty bad.
Wow. So, Dr. Bell, could you please provide us a closing statement? What are your thoughts? What would you like the community to know regarding COVID-19?
As you well know, I give these health tips on the radio. The one health tip that I get the most feedback from is something that I said, and I'm going to say it again, and that is take the damn vaccine.
Right on.
Take the damn vaccine.
Right on.
Okay. The other day I saw a gentleman, 77 years old, the same age as I am, and he wouldn't take the vaccine with one of my patients. So I said, listen, do you have children? Do you have grandchildren? He said he had nieces and nephews. I said, okay. Do you think that they would be very hurt to know that you died early from COVID because you didn't take the damn vaccine? And he looked at me. He didn't have an answer for that question. So I say, even if you don't love yourself, but you love your family, take the vaccine. So that's what I like to leave with people.
Well, thank you for joining us on the latest episode of The Beat, hosted by Radia B. And The Beat goes on. This has been The Beat, a conversation about the Charleston County Sheriff's Office in our community. I am Radia B. Look for future episodes by following the Charleston County Sheriff's Office on Facebook, YouTube, or wherever you go to get your podcasts.